Hello and welcome to the topic melanoma in the dermatology module. By the end of this topic, you should be able to define melanoma, explain the pathophysiology of melanoma, outline the causes and classification of melanoma, describe the clinical manifestations of melanoma, outline the investigations done, discuss the principles of management, and finally discuss the complications and prognosis of melanoma. Let's get started. Melanoma or malignant melanoma is a skin cancer that develops from melanocytes, which is the pigment-producing cells. Melan stands for black according to Greek word melas, while sarcoma comes from the Greek word sarcoma and it stands for fleshy growth. Carcinoma originates from Greek karkinoma and it means sore, ulcer or cancer. Melanocytes are the melanin-producing neural crest-derived cells. They are located in the stratum basilae of the skin's epidermis. They are also present at the uvea, inner ear, vaginal epithelium, meninges, bones and heart. Melanogenesis is the process where melanocytes produce melanin and they are the dark pigment that give rise to skin color. This process is regulated by a pituitary gland peptide hormone known as melanocyte-stimulating hormone. Melanin is important in the protection of hypodermic from damage by UV radiation. Melanocytes form branches to transfer pigment granules to adjacent epidermal cells. There are two types of melanin, the dark brown eumelanin and pale red or yellowish pheomelanin. Melanomas can appear de novo or due to solar irradiation at exposed, unexposed areas such as the palms, soles and perineum. Melanoma has two growth phases known as the radial and vertical phase. During the radial growth phase, the malignant cells grow in radial fashion in the epidermis. When they start to invade the dermis and demonstrate the ability to metastasize, they are now in the vertical growth phase. The lesions can be classified according to their depth. Thin is when it is less than 1 mm, between 1 to 4 mm, and it is a moderate, while thick category is for those with more than 4 mm in depth. When being exposed to excessive and prolonged UV radiation, this causes damage to the DNA of melanocytes. It causes thymine dimerization that creates mutations in the cell's gene, and when the cells divide, these mutations are propagated to the next generation of cells. When the rate of mitosis in the mutation-bearing cells become uncontrolled, it will then grow into a tumor. Most prominent risk factors of melanomas is the positive family history. Other risk factors include personal characteristics such as blue eyes, fair or red hair, pale complexion, easy sunburn, freckling, history of benign or dysplastic melanocytes nevi, and immunosuppressive states such as those undergone transplantation or having hematology malignancies. High UVB and UVA radiation exposure increases the risk of developing melanomas. Rarer causes are atypical mole syndrome such as the BK mole syndrome, dysplastic nevus syndrome, and familial atypical multiple mole melanoma. Classification of melanomas are superficial, spreading, nodular, lentigo-maligna, and acral-lentiginous melanoma. Superficial spreading melanoma is flat to irregular shape and elevated in later stages. They are usually 2 cm in diameter with variegated colors, peripheral notches and indentations. Nodular melanoma are blue-black but can be lack of pigment in some cases. Lentigo-maligna melanoma is usually more than 3 cm, flat and tan. It has marked notching of the borders and often begin as small freckle-like lesions. Acral lentiginous melanoma commonly appear on the palms and soles as flat and tan or brown stains with irregular borders. Subungual lesions can be brown or black with ulcerations in later stages. Patients will commonly complain of new lump on the skin. If presented late, the mole may be itchy, might ulcerate or bleed. If metastasis has occurred, they will experience constitutional symptoms such as loss of appetite, nausea, vomiting, and fatigue. Characteristics of melanoma can be remembered as the mnemonic ABCDE. A standby, A stands for asymmetry, B is for borders that are irregular with edges and corners, C is for colors that are variegated, D is for diameter that is greater than 6 mm, and E stands for evolving over time. Melanomas can be diagnosed by visual examination or with the help of a dermatoscope. Melanomas will stand out compared to other normal mole, and this is known as the ugly duckling sign. Skin biopsy can be done for histological analysis and Breslow scoring is used. Breslow classify melanoma into stage 1 to 4 based on its thickness. Stage 1 is less than 1 mm, between 1 to 2 mm is stage 2, while stage 3 is between 2.1 to 4 mm, and greater than 4 millimeters is stage 4. Other lab investigations can be done as well. A full blood count will reveal anemia secondary to chronic illness. Metastasis can be screened by checking for complete chemistry panel including alkaline phosphatase, hepatic transaminases, total protein, albumin, and lactate dehydrogenase. Imagings are done to look for features of metastases including chest X-ray, MRI of the brain, ultrasound of lymph nodes involved, and a CT of chest, abdomen as well as pelvis, while positron emission tomography or PET scan provides both structural and functional information of the tumor. Medical therapy is indicated as an adjuvant treatment in advanced stages of unresectable or metastatic melanoma and for resected advanced stage disease. Medications include interferon alpha, pegylated interferon, granulocyte macrophage colony stimulating factor, ipilimumab, and chemotherapy drugs such as dacarbazine. Targeted therapy for melanoma has been invented such as BRAF, c-KIT, and RAS inhibitors. They inhibit the downstream pathways which are involved in cell proliferation and tumor development. Surgical therapy is the mainstay of treatment to remove the tumor and to reduce risk of recurrence. Different surgery is indicated for different stages. For stage 0, the tumor can be widely excised at the previous biopsy site. Stage 2 requires wide excision of the tumor and sentinel lymph node biopsy. Complete therapeutic lymphadenectomy is indicated for stage 2, while regional lymph node dissection is for stage 3. Stage 4 is usually refractory to standard therapy. Caution is needed to prevent recurrence or occurrence of melanoma, such as minimizing exposure to UV radiation, sun protection measures such as wearing long-sleeved shirts, long trousers, and broad-brimmed hats. Sunscreen is an important tool in preventing melanoma. Acute complications of melanoma are wound seroma, cellulitis, and lymphedema. Late presentation of melanoma is metastasis to other organs. So prognosis is good if the thickness of the tumor is less than 1 millimeter. There is no ulceration or tumor cell mitosis, and there is absence of vascular or lymphatic invasion. Other good prognostic factors include tumor involving the extremity and early stage at diagnosis. Thicker tumor has poorer prognosis, so is evidence of tumor invading regional lymph nodes. The higher the number of positive lymph nodes, the worse the prognosis. Presence of distant metastasis and tumor presenting at the trunk or face has poorer prognosis. Being a male also increases the risk of poorer outcomes. So in summary, melanoma is a tumor produced by the malignant transformation of melanocytes. They have two growth phases, which is known as radial and vertical phase. During radial phase, the malignant cells grow in a radial fashion in the epidermis, while vertical phase occurs when malignant cells invade the dermis and metastasizes. Risk factors of melanoma include genetic, high UV exposure, personal characteristic, and atypical mold syndrome. Examination of melanoma can be memorized by the mnemonic ABCDE, and one should be suspicious of melanoma when a patient complains of skin lesions that have changed in size, color, contour, or configuration. Excisional biopsy is needed to confirm the diagnosis and for staging. Surgical therapy is done to reduce the risk of recurrence, together with the use of chemotherapy, targeted therapy, and immunotherapy. We have come to the end of this topic. Thank you.